So there's that series that was called 2.5 Men. It really gives you a perception of men's view of society and its issues. One of the issues that we have in society currently is reproductive health. And where is the man's place in reproductive health, especially as far as being responsive is concerned? Welcome to our Tech Note. I am Priscilla Regina Nalwoga. This is Morning at NTV. Our Tech Note this morning is going to be looking at increasing men's involvement in family planning. Now, family planning is considered the biggest pillar of all time attaining universal health coverage, and Uganda itself has proposed to use family planning. This is to reduce the maternal mortality and contribute to the attainment of the vision that we have as a country, Vision 2040. Of course, recognizing that in Uganda's family setting, men are often the primary decision makers about issues such as reproductive health, issues such as the size of the family, healthcare services, including family planning methods. The involvement of men in family planning issues can actually accelerate the attainment of the objectives. Now, just recently, we did have the release of the UNFPA report, the Real Fertility, and the government was urged to actually increase investment in health, in education, as well as supportive policies such as sexual and reproductive health, information and services to enable informed voluntary reproductive choices. Well, we do have a guest in studio that is going to help us understand how do we get men to be actively on board as far as these discussions are concerned. We do have Linda Birungi, who is a reproductive health activist with Reproductive Health Uganda and also Reach A Hand Uganda. Good morning to you, Linda.
Good morning.
Let's first start with a question. Why is it continuously been difficult to get men on board to have these conversations, later on have them make the healthy decisions towards this conversation?
I don't know if it's a personal opinion, but men need to start understanding better than what they do, pick information, know that they play a big role as in families, as we bring up children, as we manage our homes. They play a big role. Remember, in our communities, men, including our brothers, our husbands, and the men who stay around us are still big decision makers in whatever we do, in whatever we decide to do. And I think, but we all know that men are poor at seeking health services. So if we can work on those angles, I think we can get better. Okay,
we need to work on those angles. The other day I was having a debate with a group of men, and I was asking them about surrogacy, their opinion on surrogacy versus, you know, going the primary way of giving birth. And they said, there's no way my woman can go for surrogacy, they must give birth. And I presented to them the options that we have seen of cases of women that are unable to, and women have to suffer, you know, injectables and go through all these treatments to get them to give birth. And all these have an impact, physical and physical, seen and unseen, on their,
even mental,
on their health, on their mental, on their reproductive health. So by the time they're done with some of these processes, they're burnt out, they're done and dusted, all in the name of, because the man said he wants me to give birth naturally, instead of considering surrogacy that would have served the day and the health of his woman. And so that is why it's very important to have these conversations, to really help them understand why it is important and why some of these options are available on the table, especially as far as family planning is concerned. So I know that you've come up with a Men Plus initiative, and we want to have a better understanding of why has this initiative come up now.
One Men Plus initiative is initiative that will Reach A Hand and Reproductive Health Uganda are in partnership. And why this initiative is because we want men to understand better, to increase on how much information they have, how much they can support, but also also to get involved and have access to these methods. Yes.
All right. Let's talk about how the Men Plus initiative is actually going to be practically engaging men, whether as users, whether as partners or advocates, to support the family planning in our communities.
First and foremost, men, as we want, not expect, we want men to be overall. Like I said earlier, they are still decision makers. And their support is going to help us a lot to increase on the mortalities of, you know, even other reproductive health issues. There are many. We are talking about mortality, but there are many, many reproductive issues that are coming, that are around. Though sometimes people are silent about them, but we want men to be overall to support, because if they are the forefront players, it will increase on reducing on these mortalities, because like we said, they help us make decisions on what we need to take, how many children we have to have. And because first of all, for them, they don't have many options like we have, we the ladies or the women. For them, they have fewer options, but we want them to support us in these many, many options, but also even those few that they have, can they be part and support? Yes.
Okay. From your research, what has been some of the common reasons why men draw back from these discussions or from getting this information? Why do they hesitate to participate in family planning?
I think mainly it's lack of information, and sometimes they don't want to go and seek information from the right people. They have myths and misconceptions. They listen so much to rumors. Like I said earlier, they are not good at seeking health practices, good healthy practices. So I think it's a big problem. It's mainly myths, lack of information, and not seeking appropriate information from the right sources.
Okay. Speaking of sources, there's also a very interesting vice amidst men, or amongst men to men. When Mr. Lukwago says A, Mr. Kakoza will say that that's the gospel truth because Mr. Lukwago has said it. And so Mr. Kakoza will go and impose what has been said without even seeking a better understanding of what was the actual environment that aided Lukwago to make that decision. Is it the same applicable environment for my case? How are you intending to break that particular barrier? Because that's another place. If you're going to say Men Plus initiative and they're going to sit down and say,
I usually tell people that issues to do with reproductive health, everyone is unique. Like you give an example of Mr. Lukwago and Kakoza. Kakoza might be saying the truth, but in what situation? In what circumstances? In what kind of environment did that happen? And what kind of environment, what kind of situation is Mr. Lukwago? So in most times, I usually tell people, be yourself, look at yourself as an individual, do not depend on what others say or what others are going through or what others are using as the final say. Seek from the appropriate sources. And sometimes there are also fears because of the myths and misconceptions. A, B, C, D will happen if I do this. So those fears, those myths and misconceptions, the rumors also push back the men to come and participate in this thing. And there's this thing, I think sometimes it's, what should I call it, prestige, what we want to keep there. But
well, there's ego, there's prestige, there's culture, respect.
Yes, you're keeping
keep
there
our rituals, our norms.
You're keeping there, but in this day and era, in this modern world, is that the right thing to do?
But modern world stops in Kampala, Linda. If we go outside Kampala,
yes,
there's no modern world.
True. That's why we are saying we want to continue with this gospel, continue with this information giving, and make sure that we can reach as many people as we can. We can provide these services as many as we can. Okay. Because in the long run, it's going to, the cycle continues. The older men will go away, the young ones are coming. So that's why we are looking at all ages. I still think some of these things need to be talked about even when we are still in school. When our children are still in school, as they grow up, they are able to make decisions that will help to make it. We are looking at 2040, but how shall we get there when we don't take some of these steps? Yes.
All right. Actually, you're very right. When culture has already shaped my mind, religion has already shaped my mind, and then you come in when my mind is already set.
It actually, I still think it has to start from home.
Yeah.
Because, you know, we all believe home is the best place. Charity starts from home. So it's not about the people who have the knowledge. So if we equip these people with this information, they start with their children, I think with time we will be in better positions to access some of these issues.
Okay, Linda, you did make mention of myths and misconceptions that do linger amongst men's circles. What are some of those? Share some of those with us.
I'll talk about, particularly for this particular initiative, Men Plus, we are looking at doing permanent methods as the main option. But there are issues, I don't know what language to use, but there are issues like when my tubes are cut, maybe my performance will reduce. Those are myths and misconceptions. I'll be less a man. Mainly that is the thing that causes so many other things to come around and change their mindset, change the way they look at things, change the way they think. So in the process, but it still starts with the circles. But the circles start like that to say ABCD because they are lacking appropriate information.
Okay, so how do you intend to actually engage men with this Men Plus initiative, knowing that you have to sit with the circles? One man to one man may be difficult because he has to go back to the circle and say,
yes,
friends, I went to Linda, they explained it.
First and foremost, we want to have, we would call peer leaders, in simple terms, peer leaders who have gotten information, proper understanding, and to be able so to penetrate these communities. But also to use testimonials, to use those who have gone through to give their experience, to give them appropriate information. If a fellow man speaks to them, maybe they will have a better understanding than when me, I will speak with an experience, with knowledge and so on. But the fact that I'm not a fellow man, it may make an impact because I'm speaking with knowledge, but for a man who has been there or who has gotten the service might give a better understanding and they might believe in them if a fellow man. So we want to give off, to have information to many men as much as possible so that they can support us to give that information to fellow men. Yes. All
right, what are some of the methods that men can actively participate in to be able to help ensure universal health coverage in Uganda?
One, I have mentioned the permanent method like vasectomy. But there are even those, even before, because you do a permanent method, it's a permanent thing, you cannot reverse when you choose. But there are those that you can use, like use of condoms, as you make your decision. Like I said earlier, men don't have many options like the women. women, we have variety. I can even change from this one to another. Today I will use an implant, the other time I will choose to take an injection or take an IUD, because they are all temporary. As much as we also have permanent method for women, but also the permanent method, if I am married, my partner has to be has to be supportive. As much as we believe your reproductive issues are your right, you can make a decision even without any other person deciding for you. But I still believe if men are on board, if our partners are on board, it will make a bigger impact than when me, Linda, as an individual, I make a decision on my own. All right,
Linda, as we're coming to the crown of this conversation, I know that there's call to action, and what is that message that we want to send to our men? What do we want them to understand, and how can they reach out in case they've been triggered by this conversation and would like to seek more information?
One and foremost, we want the men to become part, access more information, take up these services, support even the women. As much as we are looking at men taking more of these services, but there are those, maybe these are long-term decisions someone needs to take. But if there are those short-term or temporary ones, and your partners can choose to take them, please support them. But how can we access information? All reproductive health centers have the information. They'll give you all the information you need. They will give you all the necessary services you need. But even health facilities, public health facilities, Reach A Hand is in communities giving the gospel about this, and we want men to come on board. We are requesting men, please come on board. This is a modern world. We want to see these reproductive health issues reducing by 2040.
All right, and that will go a long way in helping us achieve our vision 2040. That brings us to the end of this conversation. Coming up in our Kickstarter, we get to look at voters' perceptions of electability with Chris again. Please stay with us.